So my name's Jonathan Webb. I'm a consultant knee specialist here and one of the founder members, as it were, of Fortius. I enjoyed sport throughout school and childhood and managed to combine medical school and rugby to the point where, as I qualified as a doctor, I played for England to get 33 caps and eventually retire at the age of 30 when it was pretty much becoming professional. It was great fun. To get something as big as Fortius off the ground, London is absolutely the place to do it. So Andy Williams and Jonathan Lavelle were good knee colleagues and friends who I'd known for a number of years. We all did fellowships in Australia. Whilst I was working in Bristol and they were working in London, they were guys I'd known for many years. I didn't want to work alone in private practice. I wanted to have a group. I'm a team player and I wanted to be part of a team. So I think that was a factor in me sort of pestering Jonathan and Andy to think about it. And eventually they started putting it all together and putting a few names together, which eventually became Fortius. So I think being a consultant and a shareholder means you have a commitment to not just your own work, but to the whole of Fortius. You feel far more empowered to want to help in every aspect to make every part of the company and the clinic grow and be as good as it possibly can be. I think there are about six or seven of us that sat around a kitchen table to start it off, and it's now huge. I think for the patients, they can have comfort that there are guys who have got great expertise, but also have that patient rapport, that ability to relate to people. You cannot work alone. You know, sometimes somebody refers you a knee problem, but actually it turns out to be a hip problem. And in a group like Fortius, you've got experts in every area, so there's absolutely no need for you to stray out of where your niche market is. So whatever the problem is, there'll be somebody here who is really good and we'll be able to fix it. The practice locations I work in London are here, obviously 17 Fitzhardinge Street, which is the first clinic, if you like, the first place we developed. That's probably where I do most of my consulting. We've now got a few consulting rooms across the road. Then surgically, I work at the surgical centre, which is just across Manchester Square. That's a purpose-built day stay, overnight stay, kind of keyhole type surgical centre. And then finally, occasionally go down to the city where we've got our city clinic. Slightly different feel to it, but hopefully suiting the city lifestyle. Well, the advice be, you'd be mad not to join. I feel really, satisfied that I'm sort of up there with who I consider to be some of the best surgeons in the country. So I think the strength of a group is hugely powerful. You'd much rather be part of a really good team that is pushing you rather than be the best of a very mediocre team. That's not going to push you forward.